headaches. They can happen anytime, anywhere, and for multiple reasons. And they can keep you from doing your normal daily activities. That's no fun. But you know what? There is hope. And without drugs too. And we love that. So let's join Dr. David Williams and learn more. Dr. Williams, why does chiropractic work so well with headaches?
Well, headaches, there are a lot of different types of headaches. The most common type of a headache is a muscle tension headache, which usually is caused by stress of some sort. Headaches, a muscle tension type of a headache responds really well to chiropractic care because the muscles that usually get tight with a muscle tension headache are the ones right on the sides of the head, down into the neck, into the upper back area. And the adjustment, which moves the segments, the bony segments that are attached to those bones, can almost always help to alleviate a muscle tension type of a headache. And so that's one of the types of headaches that responds very, very well to chiropractic care, muscle tension headache.
Well, does the type of adjustment matter as to the type of headache you have? Or is it pretty much most headaches your patients have get basically the same adjustment?
No, again, you have to be very unique and precise because every person is different. And your chiropractor is uniquely equipped to evaluate and determine if what the subluxation pattern is that a person may have that is experiencing a headache. Now, with regards to chiropractic, we don't actually, quote unquote, treat headaches. But what we do is we adjust and remove interference to the nerve system so that the body can heal itself. And that's the unique approach that we have to healthcare. Is we don't mask the symptom, but we work on the cause of the symptom, which would be interference to the nerve system. And the adjustment is designed to balance that.
Okay, well, it seems people suffering with sinus headaches are very common these days. But is the sinus conditions related to the nervous system, and can the chiropractic adjustment actually help in this situation?
Absolutely. See a lot of people that have sinus headaches, and that can be helped with the adjustment. It can also be helped with taking care of the digestive system. A lot of times a sinus condition, an allergy or things is a result of the intestinal system being full of mucus. And then that can result in mucus collecting in other areas, including the sinuses. So when we get exposed to an allergen or a virus, it can cause pressure in the head and give us trouble. The adjustment can help that. There are some cranial adjustments that can be used as well to actually release pressure in the sinuses. But again, we need to figure out what is it that's causing the headache, the pressure in the sinuses, and what can be done with regards to the adjustment. And again, every person is unique in their physiology and their subluxation pattern.
Okay, well, if I'm getting a headache on a regular basis, is it a good idea to keep a log or a track when and why I'm getting them? Is it good information for you?
It's fantastic information for us as a physician. In fact, one of the most common types of headaches, and one that is very closely associated with patterns, is the migraine headache. Migraine headaches are typically experienced, not always, but most of the time, by females. Usually around their menstrual cycle and or increased stress levels. And a migraine headache is something that we as chiropractors do very, very well with because it is a neurological and blood flow type of cause for a headache. Usually they're one-sided. Usually lights will bother a migraine headache and loud noises. It's if you look at the etiology of how it happens, is for some reason, and this is the unknown factor, for some reason the blood vessels that go up to the head and brain, for some reason they constrict, and it's usually in that constriction that somebody will experience a prodrome or a stars flashing or some type of a, oh no, I'm going to get a headache. And when that happens, then the nerve system goes, whoa, we're constricted too much on the blood vessels that go in there, and it overdilates the blood vessels that go to the head. And then with that overdilation, we get an increase of blood flow into the cranial tissue, and that causes a pressure. And again, it's usually more often than not one-sided, and that's why the lights bother it. Any pressure bothers it. The best thing that most people do is they go in a quiet room and just tell everybody to get out of their life and lay down and just wait for it to go away.
Well, is chiropractic typically a temporary relief for migraines, or is it something that's been successful in eliminating them, just getting rid of them?
Well, both. You know, if we can catch somebody in a migraine headache, a lot of times we can help with the headache at the time. Long term, what we want to do is we want to deal with, well, why is that? What is the cause of that headache? Is it the subluxation complex, which chiropractors are uniquely trained to evaluate and adjust? And if there's a pattern that's associated with the headaches, you know, a neurological pattern or a time frame pattern, and we can change the pattern through the adjustment, we can help with headaches long-term, migraine headaches long-term, and also muscle tension headaches and sinus headaches, because there's a direct connection between the function of the nerve system and the skeletal system and the way the head feels with regards to a headache.
Okay, now it's the weekend and I got a headache. I know better than to start taking some over-the-counter drug, Tylenol, aspirin, whatever. But is there something I can do for relief before Monday and maybe my next chiropractic appointment? Could be a long weekend. Need some help.
So one of the best things to do with regards to a migraine type headache is to lay on your back, put some ice right up underneath the low part of the occiput or the back of your head and the high part of your neck, and put some heat way away from the head, from your head. Why? Because a migraine headache is an overdilation of the blood vessels. Ice is a vasoconstrictor. So you put ice up here in the head and you create a demand for blood somewhere way away from the brain. So in the big muscle groups, like in your rear end or in your legs. Again, laying on your back with your legs up is usually the best position to do that. There are a number of other things that can be done. Ask your chiropractor. They have ideas of all kinds of things that can be done in addition to the adjustment that helps somebody that suffers with a headache.
Okay, but the main thing is to forget the Tylenol and the aspirin.
The pills are a mess. The reason that you have a headache is not because you have a Tylenol deficiency in your body. So we don't treat it with an additional bit of Tylenol. What we want to do is address the cause of the symptom, and the cause of the symptom is something's out of balance. And we want to get it back in balance, get adjusted.
So long-term, can headaches be eliminated through chiropractic?
We see that happen all the time. All the time.
Great.
And particularly with more of the muscle tension headaches. The migraine headaches are a little more difficult to care for, and they do take a longer period of time to work with. And also the sinus headaches oftentimes require an investment in time and doing home therapies as well, making sure that your chemistry is clean, drinking lots of water, those types of things. Can definitely help with both a muscle tension headache and a migraine headache. But to answer the question directly, can we eliminate the headaches? We can eliminate the source or the cause of the headaches, and the body will take care of it by itself. And that's the magic or the miracle or the great part about chiropractic is everybody is unique. The adjustment is unique to them. And can it help with symptoms like a headache? Absolutely. See it all the time.
Great. Thank you, Dr. Williams. Thank you so much for taking the time to share this valuable information with us and everyone else.
Thanks for having me on the show.
Great. As Dr. Williams shared with you, it's your turn. The next time you see or know someone suffering from headaches, please speak up and tell them about chiropractic. You can make a difference in their lives.